Howdy everyone, Matt and Mateo here, coming at you with another orthopedic special test. And this one, so the elbow, it is the OK sign, or the pinch grip test, or the Kiloh Nevin test. So this one has a very interesting backstory on it. So the earliest paper that it is referenced to say that it came from was back in 1952 by Dr. Leslie Kiloh and Dr. Samuel Nevin, who were British neurologists. And actually, Dr. Kiloh, I believe I'm saying the name correctly, did discover a whole lot with peripheral disorders and things like that. So he has published a whole lot on that. But in this paper, they discuss two cases of individuals where they had a deep forearm pain, they had weakness in the muscles that were innervated by the AIN, so the long flexors of the index and the thumb. So that's the flexor pollicis longus for the thumb and the flexor digitorum profundus for the index finger. Now these people had no sensory loss and no evidence of any kind of more proximal median nerve lesions. So they were recognizing that, hey, these symptoms are coming from an issue with the anterior interosseous nerve. And they were saying, well, that AIN could be affected in isolation. Now, I will say, in this paper, they don't explicitly say this sign or test. They don't explicitly talk about it. But they make reference to something. They said that these two individuals had issues like doing their job with picking up fine things or doing fine motor stuff. So it kind of mentions it in a roundabout way there, but not fully. But anyway, let's get in on how to do it. To perform this test, it's really quite easy. You ask the person to do the OK sign. Say, hey, can you do this for me? And what you are looking at is what happens with the tips of the fingers of the index and the thumb. So if there is no lesion, they can be able to touch the tip to the tip there. But if there is an issue going on with the AIN, they're going to put pad to pad. So you're going to have this kind of look, or you're going to have this kind of triangle shape going on. So it's pretty interesting little things like, hey, can you do that? There you go. And that's how you perform the OK sign. And getting in on the research for this test, there's nothing really for it on like the reliability, validity, sensitivity, specificity. There's nothing on it. And I will tell you, when it comes to anything like involving the hand, now I know this is like an elbow test, kind of this whole area. Often there's not like studies done on it. It's just kind of included as an assessment. There's something, you just do this as your assessment for that. So there's nothing really on it for there. But I will say that there are a few interesting things about it. So one, they don't believe it that most cases are actually a nerve entrapment. I know I was taught that. I was like, oh, the AIN is entrapped, and so that's the problem. They actually think it's more of a neurologic amyelopathy. Hopefully I said that, or amyotrophy. Hopefully I said that correctly. Where the people develop a very sudden, severe forearm pain followed by the weakness without any kind of compression, which is kind of interesting because, as well, this may not even act like it doesn't act like an entrapment because it's just only motor that's involved in it. So it's only that. So there's no numbness or tingling. So it doesn't act like other issues that are entrapment. So that's an interesting thing about it. They also think sometimes this could be caused by an accessory muscle called the Ganser muscle, which could possibly compress it. So again, kind of getting over to maybe like a compression in it. And that Ganser muscle is the accessory head of the flexor pollicis longus or the flexor digitorum profundus, which they say around 20 to 60% of people have. So they think, okay, maybe that this is right there. And then lastly, kind of like what they mentioned in the original paper, that one way back in 1952, that weakness is kind of subtle. It's not something that is like really, really severe because we have so much redundancy in our hands. They said it's really sudden. So they may say like, I'm only having the problem with the fine motor stuff. When I'm doing my buttons or having a hard time, writing, picking up a needle. These are really fine motor activities, which if you read that original one, that's what the subjects were saying, that they were noticing some of these really fine motor activities that they were having trouble doing. So it's pretty interesting. So anyway, that's the OK sign or the pinch grip test. We hear about it. I thought I would just look at it. I kind of want to see what the history of it was. Let me know. Do you use it? Have you ever had a positive? Have you had somebody who did that right there like that? Who couldn't do that, they only did that? Anyway, let us know down in the comments as well. Of course, if you like the video, please hit like on there. Just throw that love out there. And anyway, and as Mateo always says, take care of yourself. Take care of your patients. We'll see you next time.